Your scan says normal, but your knee still hurts. You went to the doctor, you did the x-ray, maybe even an MRI, expensive, time consuming, 40 minutes inside that machine, and the report came back normal. And then you were told nothing is seriously wrong. Take some painkillers, rest. But your knee still hurts. You are still limping. You are avoiding stairs. You can't sit cross legged. You hesitate before getting into an auto. And now, along with the pain, there is doubt. Is this my head? No, it's not your head. And in this video, I'm going to explain exactly what is happening, because this is one of the most common and most misunderstood problems I see every single week. I'm Dr. A.K. Venkatachalam, founder of the Madras Joint Rejuvenation Centre in Chennai. For over 26 years, I have treated joint problems from complex replacements to advanced biological treatments. And I deal with this exact situation almost every single day. And I've seen so many patients walk in with normal scans but very real pain. So let's understand something important. What scans can show and what they cannot. What scans actually show? Let's start with basics. An X-ray shows bones. That's it. It tells us about fractures, alignment, advanced arthritis, but it tells us almost nothing about soft tissues. An MRI is more detailed. It shows ligaments, cartilage, meniscus, bone marrow. But here is the key point. Even MRI has limitations. Scans cannot show pain. They cannot show nerve sensitivity. They cannot show early biochemical damage. They cannot show inflammation at a cellular level. They cannot show how your knee behaves when you walk, climb stairs, or squat. Because MRI is done lying down in a static position. A scan is a photograph. Pain is a process, and those two do not always match. This is something every experienced orthopedic surgeon knows. The link between scan findings and pain is weak. Many people over 40 have meniscal tears on MRI and no pain at all. Their scan looks abnormal, but they function perfectly. On the other hand, some patients have severe pain with completely normal scans. Pain does not come from the scan. It comes from your nervous system. So if your pain was dismissed because your scan is normal, that is not your failure. That is incomplete clinical reasoning. Why pain exists despite normal scan? Let me walk you through the real causes. Reason 1. Early cartilage damage. Damage begins at a microscopic level, long before it appears on MRI. Like damage inside a wall. The paint looks fine, but the structure is weakening. Standard MRI often misses this stage. Reason 2. Synovitis. Inflammation inside the joint. The joint lining becomes inflamed. It releases chemicals that cause pain and stiffness. This inflammation can be subtle, not always visible on routine scans. But the pain is very real. Reason 3. Referred pain. The problem may not even be in the knee. Hip issues, spine problems, nerve compression, all can present as knee pain. I have seen patients with multiple normal knee MRIs when the real issue was in the spine. Reason 4. Patellofemoral dysfunction. The kneecap is slightly off track during movement. This happens due to muscle imbalance, very common. Pain comes during activity, stairs, squatting, prolonged sitting. But MRI is static, so it often looks normal. Reason 5. Nerve sensitization. After injury or inflammation, the nervous system becomes hypersensitive. The pain alarm stays on. This is called central sensitization. It is physiological, not psychological, and it does not appear on any scan. Reason 6. Metabolic factors. very common in our population. High blood sugar, insulin resistance, chronic inflammation. These create a toxic joint environment. The joint suffers chemically even when structure looks normal, and MRI cannot detect this. What should actually happen? So, what should a proper evaluation look like? Not just looking at a scan. A real clinical examination is needed. At our center, I assess range of motion, ligaments, patellar tracking or kneecap tracking, joint line tenderness, gait, how you walk, knee alignment, and beyond the knee, your metabolic health, blood markers, lifestyle factors. Sometimes we use ultrasound, which is dynamic for screening. For example, for Hoffa's fat pad, it shows the joint in motion. Sometimes the issue is outside the knee, and sometimes we detect early biological changes that are treatable. What you should do, if this is your situation, first, trust your pain. Normal scan does not mean normal joint. Second, seek proper evaluation, not just report reading. Third, check your metabolic health, HbA1c, vitamin D, inflammatory markers like CRP. Fourth, observe your pain pattern, stairs, sitting, squatting. These clues matter. Fifth, avoid extremes. Don't rush into surgery, but also don't accept nothing is wrong. The truth lies in proper assessment. Every week, I see patients who are told your scan is normal, you're fine, but they were not fine. And with proper evaluation, we find answers. If this sounds like your problem, don't wait. Get it properly evaluated. The booking link is below. If this helped you, share it with someone who needs it. And tell me in the comments how long you have been living with knee pain despite a normal scan. You deserve to be heard. You deserve a proper diagnosis, and you deserve to get better. I am Dr. A.K. Venkatachalam at the Madras Joint Rejuvenation Centre.